prevalence of coronary artery disease in India is progressively increasing as the data shows that cardiovascular diseases were accountable for 28% of total deaths and 14.1% of total disability. Diabetes, hypertension, the elevated low-density cholesterol, and smoking were observed as the conventional risk factors that alone appear insufficient to explain the higher risk of acute coronary syndrome in India. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about the metabolic risk factors that are involved in coronary artery disease. In acute coronary syndrome patients, the focus is on major conventional risk factors like diabetes, hypertension, the elevated low-density cholesterol, and smoking, whereas various other factors that are the specific metabolic risk factors, including high-density lipoprotein cholesterol, the body mass index, the waist-hip ratio, and triglycerides, as well as the HbA1c levels, get very less attention. So, a prospective case control observational study was conducted from 15 tertiary care hospitals in India. The conventional risk factors and metabolic risk factors in patients presenting with the first incidence of acute coronary syndrome were compared with the matched controls. The risk factor prevalence in cases versus controls for hypertension, diabetes, smoking, as well as the elevated LDL cholesterols were all noted. The metabolic risk factors, including BMI, waist, hip ratio, the high HbA1c, the low HDL cholesterol, as well as the elevated triglycerides were also marked. So the conventional risk factors were hypertension as 2.3, diabetes 4.7, the high LDL cholesterol was 3.3, and smoking was 6.3. While the metabolic risk factors were waist-hip ratio at 2.4, high HbA1c at 3.2, low HDL cholesterol at 2.2, and elevated triglycerides at 0.8. So in conclusion, the researchers said that in India, the risk of acute coronary syndrome conferred by specific metabolic risk factors is comparable to that which has been caused by conventional risk factors. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.